Hi, I'm Lawrence Bergstrom, registered osteopath of over 25 years experience, a former NHS osteopath and a non-surgical spinal disc decompression specialist. Now, in this video, we're going to talk about the subject of osteoarthritis. Now, something that people are often surprised to hear is everybody from the age of 30 onwards has a degree of osteoarthritis. Okay, so we're going to discuss a little bit about what osteoarthritis is, a little bit about what you can do to manage it, and that it's something that's extremely common and affects us all to a degree as we get older. So firstly, what is osteoarthritis? Effectively, on medical imaging, whether it be a plain x-ray or an MRI, we can see a degree of what your doctor might call wear and tear. Now, what does that mean? Effectively, we start to see some narrowing of joint spaces, we might start to see some inflammation, we might start to see some cystic changes, and we might start to see some sclerosis in the bone surface. So these are all as a consequence of increased pressure on the articulating surfaces of the cartilage. So all joints have cartilage within them, so hyaline cartilage, and that cartilage is designed to really to articulate with itself, and it's separated by a degree of synovial fluid as well. So if you like, there's a joint oil in there, and the joint, when the cartilage is very smooth, it moves very, very effortlessly and freely. Unfortunately, with time, over time, what happens is the articulating surfaces start to become a bit pitted, they start to become a bit roughened, and as a consequence of that, that roughening leads to a degree of heat and friction, which then ultimately turns into inflammation, and then that can lead to restricted range of motion and pain. Now, there are two predominant types of osteoarthritis. There's what we call primary osteoarthritis and secondary osteoarthritis. So primary osteoarthritis is more related to, we believe, as far as the researchers can tell us at present, more related to what we call familial or a degree genetic disposition. So for example, your mum or dad might have had a lot of arthritic change in their knee or hip at an early age, perhaps in their early 40s, and then they've gone on to have a knee or hip replacement very young. So that would be an example perhaps where we're starting to see a trend there of family sort of connection to osteoarthritis. Now, secondary osteoarthritis is more related to other events. So for example, if somebody's working on their knees for hours and hours a day, maybe a tradesperson or somebody that played a very high level of football or played football intensively for years and years, or for some runners, not all runners, but for some runners, they've really put a lot of pressure through their knees and hips. And again, we will see a change on X-ray or MRI, where we see a narrowing in the joint space, we see some sclerosis in the bone, some inflammation in the bone, some inflammatory fluid, and so on. So infections, if you get an infection in a joint, it's important, if you've got a red, hot, swollen joint, that you get into the hands of the doctor very, very quickly, or you go to A&E or an urgent care clinic, because if you have an infection in a joint and it's left for too long, the infection can completely destroy the cartilage in your knee or any other joint for that matter, and that can lead to, ultimately you needing a replacement joint or surgeries. And particularly if you're feeling unwell. So it's a medical red flag. If you have a joint that's red, swollen, you're feeling really unwell, or possibly not that unwell, but there's a very inflamed joint, get yourself into the hands of somebody medical very, very quickly. Now, everybody from the age of 30 has a degree of degenerative change in parts of their body. So that can be mild, moderate, or severe. Generally speaking, the younger you are, the less severe it is, but there are exceptions to that. But the primary areas that you will find it, or the key areas that you see it on medical imaging, will be in our necks, our lower back, what we call the cervical spine and the lumbar spine, perhaps a little bit in the tips of our fingers, We start to see a little bit in our knees as well, and perhaps a little bit in our hips. Now, some people will have a significant amount of degenerative change on medical imaging, but they'll only have mild pain and moderate immobility or stiffness. Some people, interestingly, have a really quite severe amount of change, so narrowed joint space, quite a lot of inflammation, a lot of immobility and so on, but not much pain. So the degenerative change itself doesn't necessarily dictate the amount of pain that you're in. One of the considerations is the articulating surfaces, the cartilage, are not the primary cause of pain, and the synovial fluid that sits in and around the joint and in other tissues actually carries a lot of the mediators that cause you pain, and more research is being done to look at that. Now, in terms of the spine, so us as spinal specialists, when you come to see us, we will typically tend to see degenerative disc height. We'll start to see at the rear of the joint here, these facet joints, there's a degree of narrowing in the space here. We'll start to see some bony growths here, what we call osteophytes, and we'll start to see some inflammation in here. Now, in the spine, we call it spondylosis. Okay, it's a form of degenerative change within the spine. It can be localized to a given area. It can be throughout the spine, but typically more so in the neck and the lumbar spine. Now, osteoarthritis differs from rheumatoid arthritis, which is more of a systemic problem. It can affect internal organs, it can affect a range of other organs within our body. And again, very similar to osteoarthritis, you can have flare-ups. So you can have a very aggressive period where a joint feels, or more than one joint, will feel very, very hot and painful. With rheumatoid arthritis in particular, you might start to feel really quite generally and systemically unwell. Osteoarthritis, typically, perhaps a knee is feeling very, very sore and painful, for example. So this gives you a little understanding of the differences between, well, you now know a little bit about osteoarthritis in terms of you have primary osteoarthritis, which is more linked to genetics and a familial disposition. Secondary osteoarthritis, which is more linked to physical strain on the body and repetitive strain on the body. And you can differentiate that a little bit between the more aggressive sort of systemic condition of rheumatoid arthritis. And also in this video you understand now a little bit about arthritis, or what we call spondylosis, within the spine, but all is not lost. Okay, there are things that can be done. If you see your orthopedic consultant and you've got a lot of arthritic change in the spine, they might try, in addition to some form of pain relief in terms of medication, they might try some form of corticosteroid injections. If you come to see us, we will utilize manual therapy, acupuncture for pain relief, and if it's really quite severe, we use a particular system that we've had success with, where we use non-surgical spinal decompression therapy to start to take the pressure off these joints, try to improve the fluid content and the dynamics within the disc in terms of the physiology within the disc. Because if we can improve that a little bit, then it takes a bit of pressure off the joints, and then people start to feel more mobile. So hopefully you found this video of some value and some interest, and thank you for watching.